Hello, I'm Pauline Walsh and I'm Pro-Vice-Chancellor for Health and Wellbeing here at Keele University. I'm really delighted to share with you our new university strategic plan around health and wellbeing. The aim of our health and wellbeing strategy is to enable a culture here at Keele and an environment that fosters wellbeing, to enable staff and students to flourish in their time at Keele. During the course of the development, we've communicated and consulted with many groups across the university. We held a strategic conversation. We've had a session with the Student 100 group. We've had a session with the Keele Staff Voice group and lots of other areas where we've asked for your feedback, and this strategy now is a result of all of that work. The strategy aims to provide an environment and a culture for all staff and students to flourish and to really promote well-being in the things that we do. In order to achieve that, the strategy has been aimed at having a number of themes and priority areas, and those themes are people and communities, positive environments, curriculum and learning, policies and practice, and culture and behaviour. And where we are now is thinking about the way in which each of those themes have got a number of priority actions that we're committed as a university to taking. The whole of that strategy is then overseen by the strategic group of the Health of University group, which will provide some monitoring and steer to the activities we do. So in order to give you some flavour of the things that we'll be doing, I'm going to ask two colleagues who were leading on either the staff initiatives or student initiatives to share some of the things that we're doing.
Hello, I'm Nick Ratcliffe, Head of HR Strategy and Policy, and my role on the Healthy University Group is focused primarily on staff initiatives. What we're hoping to do with this strategy is really empower our staff to start to take responsibility for their own health and wellbeing through providing a range of resources that are accessible to our staff. We're very mindful that people are individuals and will want to access different things. Our line managers are key to ensuring that staff feel that they are able to access these resources and initiatives. So one of the first things that we are starting with is a learning and development programme for some of our senior leaders. The University Leadership Group will be receiving a session on mental health and wellbeing during the launch of the strategy. And that is the start of a programme of learning that will explore health and wellbeing in the workplace and will enable them to take that back and make a difference to the working environment. We'll also be introducing Wellbeing Champions. I believe I'm the first trained Wellbeing Champion here at Keele. Where we want to get to is having an individual in each school and department as a Wellbeing Champion who can help us bring the strategy to life and help communicate what we're doing and how people can access this support. We've been thinking about health and wellbeing for a little while in HR, and we've started to make some small changes that are starting to make a difference to how people experience work. For example, we regularly have Dress Down Fridays. We have participated in the Rogue Britannia Sport Relief Challenge. We're doing the Step Challenge at the moment. And I'm going to be encouraging our staff to participate in the email holiday that will be taking place at the end of the Wellbeing launch week. These small changes can make a real difference to individuals and how they experience work, and we want to get more people talking about their health and wellbeing, and I'm excited to see what we deliver through the strategy.
I'm Katie Laverty and I'm Director of Student Services for the University. I think the Health and Wellbeing Strategy is a fantastic commitment to the whole community approach, and we need to remember that health and wellbeing isn't just an add-on, it's critical to keeping ourselves well and being able to flourish, and that's both for staff and for students. It's really important that we take a whole institution approach, which is what we've done with the Health and Wellbeing Strategy, and it's great to see things in there like looking at how we embed wellbeing into curriculum so it really does follow the student journey. We're also building on some of the good work that we already do, particularly the work we do with our student unions, building on campaigns and activities such as our Never OK campaign. We've also got our Start to Success project, which is a really ambitious project, which is funded from the Office for Students as well as the university, and we're working with a number of partners in the region to look at and support students' transition into, through and out of higher education. So that's really focusing on students in the region, and we're working really closely with Staffordshire University, NHS partners, the police, local authority and further education providers in the region to look at improving the mental health support for students in the area. With our Health and Wellbeing Strategy launch, we have a Health and Wellbeing Week coming up, so I'd really encourage lots of students to look out for lots of activities and campaigns that they can get involved with during that period.